A very good morning, good afternoon, and good evening to all the people who is watching our channel, the Prerana. Myself, Ramakrishna, was a coordinator for the Prerana, the Talk of the Week program, and one of its kind. We are inviting a lot of resource persons from various fields, and the spectrum of talk has been diversified for the benefit of all the student and teaching fraternity, and whoever is watching from any background. It should be helpful for them. Today we have got a diversified topic, and as you cannot guess, one of its kind. This is one of the interesting and most relevant topic, or a need of an hour. The topic goes like the medical spectrum, diverse avenues after 12th. As we are all well known that after NEET, there is a lot of students who is waiting to pursue the medical service. How to choose the field, how should be a student approach, and how should be a mindset. All these things will be revealed today in this talk of the week, Prerana. As a part of Prajna team, I'll be representing as a coordinator for this event, the Talk of the Week program, and to just take an introduction about our resource person is Dr. Tejaswini Ramesh, who has pursued her MBBS from BGS, GIMS, and she is pursuing her post-graduation from Rajarajeshwari Medical College in OBG. To her path or a successful steps, she has done a lot of women empowerment programs in schools, colleges, and many institutions, just for a benefit of girls and other community talks as well, as a background of medicine. And she has done free health camps in most of the places in and around the city where she is residing now in Bengaluru. There is a lot of recognitions she also got in these footsteps. One of its kind is from Rajiv Gandhi University recognition. Then today, let us not give much more introduction. Let us jump into the talk, and we'll meet Dr. Tejaswini Ramesh now for our talk. Over to you, madam.
Hi and hello to everyone. I am Dr. Tejaswini Ramesh, and I am pursuing my post-graduation in Rajarajeshwari Medical College as in the field of Obstetrics and Gynaecology. As many of you have dreamt of becoming a doctor, and the after 12th you want to choose the field of medicine for your own reasons. Like my reasons were to serve people, to have the hand of healing where someone else's pain could be relieved by our mere knowledge and hard work that would have put through so many years. As today's topic would be after 12th, like what do you want, like if you want to pursue in the field of medicine, what are the small steps that it could, from my side, that could help you guys to come into this field. Firstly, during the first 12th standard, if you are very much keen in pursuing medicine, you firstly require a lot of dedication to this field. There will not be much personal life, where there won't be much family life. You should be in the mindset where you're going to sacrifice all those, and yet you can pursue better in this field. That mindset should be there. If you are okay with the mindset that yes, I'm going to sacrifice things in my life to be in this field, you can go for it. And so for that, first after 12th, you actually, now what people do is during 11th and 12th only they start studying for the NEET exam. There is a NEET UG exam in the 11th and the 12th, and there are various coaching centers, and there are various institutions are there for which prepares you for it. And then start preparing from 11th by doing a lot of MCQs, lot of papers, because each year the paper keeps changing and the marks keeps changing. Because when we had Comet K, later NEET was introduced for the very first time and we wrote NEET. And now NEET undergraduation is one of the most toughest exam a person could give, and for that you should be mentally and physically be very strong to give that exam. So start preparing from 11th and 12th itself. In that you'll have 3 subjects. It's physics, chemistry, and bio. Bio will be easier because it's just a very lively topic, and it's nice to read, and the concepts are very lively. Whereas in physics and chemistry, things are different, like especially for a person who wants to do medicine. That becomes kind of a drier subject, but that is where you can score a lot, because everybody studies bio and everybody scores really well in biology. So your core concept should mainly be concentrating on physics and chemistry. Physics was one of my favorite subjects when I was studying. So I did really well in physics, and bio anyway was a very strong subject of mine. So once you give NEET UG and you pass through NEET UG and you get really good rank, well, that should be secured. If you want a government seat, it should be around like 1,000 to 10,000. That is also a lot, like 8,000. That would score, would settle you down for a very good government colleges. But not everybody can get government colleges, but it's still okay. Especially for a person who did it in a private college, and I still did it under I did it under Rajiv Gandhi University. So my college was pretty much very good with education wise and the practice wise. So it's not clean. You did not break your head that I didn't get a government college. I secured in private college, because it's still fine. What matters is your post graduation for your practice. Because in undergraduation, your mere thing is your academics. You should see where your academics is really good. So once you secure a very good rank and you're able to get into a medical college, be it private or government, if you get a government college, it's like even much better, because your practice will be much better, and the faculty will be good. Everything is very nice in government as usual. And if not, it's still fine. Once you get into the MBBS college, you will have your first year, second year, third and fourth. These in first year you will have around 4-5 subjects. Now these every year is changing, because when we had anatomy, we had biochem, and then we had physiology. We had only 3 subjects, and later in second year we had other subjects. But these years the subjects are changing. The number of subjects that you're giving exam changes each year. But this year I don't know exactly where the other subjects lie in. Then so once you finish your first year will be really tough when you do MBBS, because it's a completely new field, and you'll have huge books, and being just out of 12th standard, you have to keep reading these huge books, and getting acclimatized to the fact that you have so many exams, and the reading volumes will be twice and thrice the amount, and crossing the first year will be the most difficult thing. Once you cross your first year, I think the only next barrier will be your final year exam, because that too will have a lot of subjects. At least it will have 9 subjects during your final years, and during those MBBS final years, as I told, it is going to be a stepping stone for your next post-graduation exam. So that time also it's going to be really tough. Your first and your final year are which will define you exactly where you lie. But as in your 12th standard, where you used to have percentages, you have to get 90 percentages and 98. There's nothing like that here. In MBBS, it's almost like you pass through or you don't pass through, and in that also, if you secure really good first class or distinction that you're really good about, and to study post graduation, start preparing from third year or second year itself, because the competition is that high. This year around 2 lakh people gave post graduation exam. So people are preparing from their second year and third year itself to appear for the post graduation exam. So from your second year only, you start preparing. There's so many platforms for post graduation, that is, you'll have your Maro, Prep Ladder, DAMS, Bhatia, and there's so many platforms. I personally loved Maro. You can start studying Maro from very early, that is your first year and second, because when we did MBBS, Maro wasn't there in our first year, but I was very happy that I was introduced to it in second last or third year. That platform really helped me in understanding the subject and securing a pretty decent rank. So you can start studying from second year itself for the post graduation at the same subjects itself. If your second year subjects are there, study second year subject in depth according to your post graduations, and then you can study your third year subjects, finish each subjects then and there. So by the time you come to a final year, you're ready with your theoretical topics and as well as your post graduation topics. And once you're done with your final year exam, you'll have a year of internship, where you have to finish your internship to give your post graduation exam. And internship will be pretty much fine, where you can actually revise all the subjects that you prepared from second year to third year. And once you're done during your internship, you finish your internship, you're good to go to prepare when you're done with your exam. So give your post graduation exam, your PG exam. That is also one of the most difficult exam, because you have to, whatever you studied from first, second, third and fourth year, you have to give the whole test in one go for 200 questions. So that is also one of the most difficult exam to give. So that's why you're telling her prepare from second year than thinking about preparing from internship. Many people start preparing from internships and all. That's not really very ideal for the amount of competition that is happening these days. So once you're done with your post graduation exam, that also same ways you are getting around 10,000, 15,000. So you're very good to go with the government college, because post graduation colleges becomes very important where you do, because it depends on how you practice. It is not about studying, where your undergraduation is all about academics and how you study, and whereas post graduation is about how you practice. So your practice becomes very important, patient load becomes very important, the kind of people come there becomes very important. So you get a good rank, you get into a good college, because in post graduation you cannot settle down for less, because you settle down for less, future becomes really difficult when you cannot practice. You have 3 years would have done your post graduation, if you still practice even after that, that's a big loss after paying this hefty amount of fee that you have to anyway pay for the medical colleges. So once you're into a very good college and your practice is good, patient load is good, you're I'm very happy with my college, because the amount of patient load is there. That is also very nice. But I would like to speak more about your mental health and physical health, that really deranges once you come to post graduation. Not everything is very fancy and nice, that you're a doctor, or it's very nice, you make money in the future. For the amount of sacrifice you do, you're mentally drained by the end of the day, you're physically exhausted, you sleep exhausted, you get up exhausted, and sometimes you question the fact that why did I even come to this field. All these questions will come even during your MBBS time. But during your MBBS time, you should think the fact that the future is going to get even more harder compared to what you'll be doing now. MBBS level is way too easy, so that should be like, okay, this is easy, so let me do this. So whereas post graduation won't be like that. It will get even more tougher, your days, time, and you won't even realize where you are, who you are, because you just get up, go work, and that's it. So you should be mentally very, very strong, especially in a field of obs and gynae, where you're required to be alert all the time, and you have to be on your tiptoes. You cannot mind to even ignore, or negligence factor is completely impossible in our field. That it's the same for in everything, in field of medicine or in anything. But if you want to go to a very happy, like I can have a work-life balance and everything, that would be radiology and dermatology. It's a very nice field where you get a 9 to 5 job, and but to reach to dermatology and radiology, you have to really study very high, because one of the highest paid, highest ranked subjects. And if you like surgical field, that is your surgery or orthopedics and obs and gynae. Pediatrics is also a very nice field. It depends on the likable to the field only you understand when you come to your internship. Your internship during your MBBS tells you what kind of field that you want to pursue, because you would be around all the departments in 1 year. In that 1 year of internship, you'll get to know that, okay, this is the field I'm interested in, this is what I want to pursue in the future. And but if you really want to do obs and gynae, but you have to be mentally, physically really fit, and for the fact that you will lose your sleep for a very long time, and you should be ready for anything at that point, because nobody is going to come and ask you that you will do it or not. They just want you to do it then and there. So if whoever is thinking of choosing medicine as their field of living in the future, because it will be a field of living, it will not be a field of making money. That will be the last thing that comes to your mind, because at that point all you need would be sleep, your family and your food. That is all that matters in the end. But whoever wants to choose this field, you should have a lot of the passion that wants to I really want to save people's life, or I want to heal people. Only then you have to come to this field, not thinking that you want to make money, or I want to impress somebody, impress family, or no, it's not like that. You should do it for just for your own sake, for your passion, and to treat people, not for anybody else. And I hope my words have really gonna put you to from 12th till post graduation a little bit of what you people can do to come across this place.
Indeed, it was a very eye opener and a practical journey. She has taken us through this 20 minutes of walkthrough of how and why. These are the two main questions it was answered. I hope whoever is seeing this, whoever is just dreamt of becoming a doctors, a future healers, to keep it very simple and humbly, Vaidyo Narayano Harihi. So as we see in her